Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Here today, answer a couple of quick questions about meloxicam. First off, what is meloxicam good for? What is it used for? Um, Meloxicam is used for pain and inflammation. It's an anti-inflammatory, a non-steroidal anti-inflammatory drug, so used to treat pain and inflammation, often associated with osteoarthritis or rheumatoid arthritis. We do see it used a lot for short-term inflammation, joint pain, across the board for any sort of inflammatory type pain. What about how long does it take to work? How long does it take for meloxicam to start working? Initially, after your first dose, you're going to notice that peak effect in 4 to 5 hours. You should notice some effect within about an hour or so. If it's chronic pain like arthritis, you're going to get your peak effect in 2 to 4 weeks. So you want to give it some time to fully kick in, and so you can realize the full benefit of the medication. So some benefit initially, but for chronic pain, it can take a few weeks for the full effect to be noticed. Is it safe? Well, most people do well with it. All NSAIDs do have risk of side effects, as with any medication, the most common being stomach pain, diarrhea, headache, and nausea. It is a good idea to monitor your blood pressure when you're on medicines like meloxicam, the NSAIDs. Um, they can also affect stomach, increase risk of stomach ulcers and bleeding. So that's something you want to watch for over the long term. Meloxicam, it does seem to be fairly low risk of these side effects, but they're there. So we do need to warn you so you could be aware of them. Most people can take this safely for years with their doctor kind of checking to make sure none of these long-term side effects are starting to occur. And all NSAIDs, all non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, atodolac, they all increase the risk of heart attack and stroke. That's why we want you to monitor the blood pressure, see the doctor on a regular basis. They can kind of see if you're tolerating it well, see if you're at a high risk for these side effects, and determine whether it's still a good idea to keep you on this medication. What about alcohol? Can I drink with meloxicam? It is not recommended. The reason being it increases the risk of stomach irritation. So it could increase your risk of having a stomach bleed or ulcers or things like that. The occasional drink may be okay, but you need to run that by your doctor first, see if they're all right with that. Um, if stomach issue is a problem with the anti-inflammatory, sometimes they'll even put you on an acid blocking medication. So if you have a sensitive stomach, just drinking, you're not going to do yourself any favors when you're taking an anti-inflammatory. I do appreciate you watching. I do have a full meloxicam video where I run down in more detail some of the issues and common questions with this medication. As always, make sure you contact your healthcare provider if you think you're having some problems or if you're having some side effects. And if you appreciate my information, I would appreciate it if you subscribe to my channel. Thanks for watching.